Good afternoon, everyone, and welcome to the Northern Institute's People, Policy and Place seminar series. This is our last seminar series in the year. My name is Kate, and I'm a researcher with the Northern Institute. Firstly, I would like to acknowledge the traditional custodians of the land on which we meet today, and for Northern Institute, it is Daile and the Larrakia. We pay our respects to Larrakia elders past, present, and emerging, and further extend that respect to Aboriginal and Torres Strait Islander peoples joining us today. Now, this afternoon we have Dr. Rung, who is a research fellow at the Menzies School of Health Research, as well as an honorary fellow with the Northern Institute, and that's why we have the pleasure of hosting them today. They will be presenting on COVID and policy-induced inequalities. Daile is also an early career researcher with experience in diverse international contexts, including Australia, America, Thailand, and South Korea. Her PhD explored the everyday emotional and material labor done by people with non-citizen status as they move across international borders under various degrees of choice and resettle in Australia. Interactive. So without further ado, I would now like to hand over to Daile. Thank you very much. Thanks.
Thanks, Kate, for that lovely introduction. I will try to speak loudly, so hopefully everyone online can hear me. As Kate mentioned, my name is Daile Rung. I'm an honorary research fellow at the Northern Institute. I'm also a research fellow with Menzies and with the Center for Male Health and Wellbeing at Menzies. Just wait a second. I'd like to thank you all for your time today. I know this is a particularly busy time of the year, so thank you for joining me, and I really appreciate that. So today's presentation is based off of a paper and I've been saying this for a few months now, I think it's about 80% done, but frankly, it's been on the back burner for a number of months. So I think this is a really good opportunity for me to just kind of get my head back into the space, and also to hear your input will be really helpful to that process, I think. The name of the paper is COVID-19 and Policy-Induced Inequalities, exploring the health and well-being implications of exclusions from COVID-19 support policies among temporary migrant men in Australia. Besides myself, the other contributors include Dr. Elizabeth Adamson, Dr. Himanshu Gupta, Dr. Noami Terry Karastesh, and Dr. Devaki Moani. I think it's worth mentioning that all of the authors are themselves migrants. So I think that we're able to approach the subject matter with multiple modes of awareness, from theoretical, empirical, but also an embodied knowledge of some aspects of the subject matter, particularly with regards to being temporary. Just like this. And I'd like to acknowledge today that we are in Larrakia country, and to acknowledge our elders past, present, and emerging. So to give you a bit of a rundown of what I'll be covering today, first I will present the research question, which is at the heart of the paper. It's what the paper is written around. Then I'll get into the contextual background, and to do that, I'll be pulling upon two threads of literature. One is COVID-19 and men's health in a more global general sense, and the other is migrant and refugee men's health and well-being in the Australian context. Then after that, I'll get into kind of taking a step back to shed some clarity around the cohort. So who are temporary migrants, or what is temporary migration? And this is because in my view, the term is quite a misleading one in many ways. So I want to just have us on the same page for a couple key points. Then after that, I'll get into the policy overview, which is Australia's COVID policy response as it pertains to temporary migrants. And then I will wrap up with some implications for temporary migrants' men's health and well-being. Now, obviously, men don't exist in isolation, so there will be implications for their families, their partners as well. And you might be noticing every time the word temporary appears, it's in scare quotes, and that's to denote that it is a state-crafted legal status, and should not be confused with being an inherent characteristic of people. Okay, so the research question is, how might exclusion from COVID-19 support policies affect the health and well-being of men with temporary migrant status in Australia? So essentially, I see the paper as being an exercise in pulling upon those two threads of literature that I was mentioning earlier and kind of connecting the dots between them in respect to the policy response in Australia. So it's essentially pulling upon literature and policy analysis. So the two threads of literature is COVID-19 and men's health. I'm sure many of you are already aware that globally epidemiological data indicates that there's a gender gap. So there's higher morbidity and mortality rates among males than females, and this is true in most places. However, most of the research is quite biomedical in focus. There's a lot less attention on the social and the contextual factors that shape men's health and well-being outcomes. So that's what this paper is addressing for one cohort. And I think it should be noted that we know very, very little about migrant men's mental health and well-being in general and with respect to COVID. And we're talking about temporary migrant men, we know even less. So there's a huge gap in knowledge there about temporary migrant men's mental health and well-being. To date, there's actually been no research done in this space with temporary migrant men, although there is some literature among temporary migrants in COVID-19. There's been one study, which I will get to shortly. The other thread of literature is migrant and refugee men's health and well-being in the Australian context, and there's two studies I'd like to point your attention to. So the first one's by Cookland and colleagues, and you can see by the date this is pre-COVID, and what they did is they drew upon a longitudinal data set, which I will also clarify in a minute, but what they found is that job conditions and job quality were significantly associated with migrant and refugee men's mental health outcomes. So if their job wasn't so great, their mental health was also suffered. The other study is also pulling upon the same data set. It's by it's by Gallo and colleagues. And what they found, this time focusing on migrant and refugee fathers, is that they were more likely to experience poorer mental health and poorer general health than Australian-born fathers. The point I want to make about both of these data sets, or both of these studies which are based on a data set, is that it draws upon the longitudinal study of Australian children, which only includes permanent residents and citizens. So that means that there is there's no available data on temporary migrants. The best we could do right now is to extrapolate that if people with secure migration status are experiencing these problems, it's likely that people with insecure migration status are also experiencing them, but we don't have the empirical evidence as of yet. Let me slow down a little bit. So going to the cohort of temporary migrants, there's 3 points I want to make. And again, this is because in my view, the term is quite misleading. First, Australia is home to many temporary migrants. It's not an insignificant amount of people. There's over 2 million living in the country today. They're here on a range of visa statuses. You probably come in contact with temporary migrants every day, certainly where we work, but also out in the community. This, to me, is a very important point to make. Temporary migrants should be best viewed as a status rather than as an indicator of how long someone has actually lived and worked and contributed and, for all intents and purposes, made Australia their home. It's a precarious residency status. There's been some evidence that they're more vulnerable to workplace abuse and exploitation. They are considered to be residents for tax purposes only. However, they're ineligible for most public services and safety nets. And Peter Mars brought this to the attention of that there's long-term temporary migrants. So it's no longer unusual for people to hold this temporary status for many years. A decade or longer is no longer unusual. There's ethical implications to this, which I would be happy to talk about later if you want to. The reasons behind this are complex. I can't get into it too much now, but I think suffice to say, some researchers, myself included, have signaled that Australia's moved away from the permanent, the settler society model of the past to a more temporary migrant society model currently. Certainly since 2000, temporary migrants have far outnumbered permanent ones, although there still is a permanent stream that comes through. And the reason for this is it's complex, but it's immigration policy changes over the past 30 years. So it's not like accidental, it's crafted through policy. Okay. So to go into Australia's COVID-19 policy response as it pertains to temporary migrants, first you may recall back in March 2020, there was economic relief measures that were introduced. So JobKeeper and JobSeeker were the main ones. Initially, people with temporary migrant status were excluded from all COVID-19 supports. There was a little bit of concession later where they could access things like super, although a lot of temporary migrants don't have super. There was a go home message delivered by the Prime Minister in April 2020, essentially saying, if you lost your job and you can't afford to sustain yourself, you could leave. And it should be noted that Australia's response was at odds with many other countries. For example, the UK, New Zealand, Canada, Ireland, Singapore, and many other countries, they recognize temporary migrants as being, members of the community and included them in national support measures such as unemployment payments, wage subsidies, housing support, and sickness allowances, which Australia did not do. So in the aftermath of this, what are we finding? And as I said, there's been one national study, which I will get to in a minute, but most of it's coming through just through the news and through secondary gray literature. And what we're finding is that pre-existing insecurities are being heightened. So heightened job insecurity. Temporary migrants were among the first to lose their jobs. Many of them worked in heavily casualized industries, including hospitality and retail. So they lost their jobs. Heightened workplace exploitation abuse. There's some evidence of that. Heightened housing and food insecurity, and this kind of all follows from, I guess, job insecurity and economic insecurity. And according to Singham, despite being taxpayers that contribute a crucial sector to the Australian workforce, migrants holding temporary visas were forced in much of Australia to rely on their savings and superannuation, and where those were exhausted or non-existent, charity. So it's not an overall rosy picture. These are just some snippets from the news. Up top you see visa holders that were ineligible for wage subsidies in a desperate situation. There was some instances where businesses stood down migrants in mass who were not eligible for wage subsidies. And the two on the bottom show international students needing to rely on charity and food banks to get by. As I indicated earlier, there's been one study, one national study, and it happened in July of 2020. The name of it is As If We Weren't Humans, so that will, I think, give you a pretty good idea of the findings. And they didn't interview, they had a survey with over 6,000 temporary migrants in Australia, and I'll just run you through some of the key findings. So many reported that it was impossible to leave Australia or they couldn't risk losing their investment. Let me make sure I get the percentage right. Oh, sorry, about 60% said, yes, the flights aren't available, it's too expensive, but even if they were, we've made so much of an investment here, we've spent years living here and a lot of money, we can't turn our back on it at this point in time. Also, another finding was that most suffered a critical loss of income. This is quite a big proportion. About 70% said they lost their job entirely or most of their shifts. And also, some indicate that they didn't receive the family support if they were receiving it. Another finding was well-being was compromised at work and home. This includes things like verbal abuse, harassment increased, some reported working in return for food and housing, doing unpaid labor, and being forced to do tasks they're uncomfortable with. Many report they cannot afford to meet their basic living needs. About 42% indicated that they feared becoming homeless. Some did become homeless for a period, and some had to, they were unable to pay for essentials. And it should be noted that temporary migrants are not eligible for admission to homeless shelters in Australia, so it's a bad situation for them. And the final thing is that current sources of financial support are just inadequate for the need, and most of it comes from charities. Sometimes there's one-off payments offered, but it didn't get to most people. I'm just going to read you a couple quotes here, and these are from some of the men that were in the survey. The first one is a master's student from the United States, and he said, Australia showed its true colors when it came to international students. They call us friends, but then abandon us in our time of need. I think Australia will struggle to attract international students after disgraceful treatment and lack of compassion shown during COVID. Another male student from India said, it's absolutely horrifying that our situation is not only neglected, but also downplayed. It's completely hypocritical that we're important for tax purposes and in the sense that we contribute billions of dollars to the economy as university fees, but are treated as some breed of untouchables. And finally, a Brazilian doctoral student said, the government speech of go home, you shouldn't stay here if you can't sustain yourself makes me feel sad and excluded. Moreover, for many people, there are just no options as there's no flights or they're too expensive and the borders might be closed. So some of the themes coming out of this, sorry, I just want to get on the right page here. Obviously, exclusion is coming out of that, feeling like they're only valuable in an economic sense, so like a cash cow, and that it's not practical or possible for them to leave the country, and also a sense that Australia's international reputation might have been tarnished from this, and there could be implications for that going down the track. So, to wrap up with some health and well-being implications for temporary migrant men, and this again is drawing upon the available evidence that we have in the policy analysis, we would expect to see adverse impacts upon temporary migrant men's mental health and general health with knock-on effects to partners, children, and families. I would think this would be particularly the case with men who have lost their jobs or experiencing economic security. Going back to Gallo and Copeland studies, we found that migrant and refugee men's their mental health was closely attached to their working conditions, so there's implications for that as well. Also, myself and my colleagues, we recently did a study, it hasn't been published yet, and what we found is that migrant and refugee fathers' well-being and caregiving decisions are strongly influenced about what they regarded as their cultural roles to fulfill the role of being a financial and figurative provider. So when men can't do that, they feel it affects their self-esteem, it affects their well-being, and affects their ability for fathering and parenting. The second point I want to make is that we'd expect to see adverse individual and public health outcomes. And there's three bits to this, really. One is exclusion from public health care, sickness allowance, and the lack of patient confidentiality. So on that, Australia excludes most temporary migrants from sickness allowance. So this means they could be compelled to work when they're sick, possibly sick with COVID-19. So there's obvious public health implications for that. And the other thing is there's no firewall between immigration offices and the hospital system. So this acts as a disincentive for visa holders, and particularly people who might have overstayed their visa or be in a precarious situation, to not want to get tested or to get the vaccination because they don't want the alarms to go off for their visa status. And it has been done in other countries, I should point out. And finally, we're seeing evidence of economic, food, and housing insecurities. Likely this would be related to elevated levels of stress and uncertainty with an already precarious population. This is likely to have impacts upon social and emotional well-being, resettlement outcomes, and developing a sense of belonging and social cohesion in Australia. So I definitely feel that further research is needed in this space. I'm hoping in the nearest future to do a pilot study exploring temporary migrants' experiences with social and emotional well-being and health outcomes in the context of COVID-19. I'd like to apply a gendered lens to this, so to include men and women and see some of the differences and similarities between them. And I'd like to do a subset that focuses on fathers and families. And this is because I'm particularly interested in how fathers' capacity to engage in paid employment and unpaid caregiving has been impacted since COVID-19. That is it. And here is my sources, if anyone's interested. And thank you for your time.
All right. I'll just say time for questions.
Okay.
Thank you so much, Daile. I think it is a fascinating piece of research that you're going to group. Now we have time for questions, so if anyone who is online would like to pop your questions in the chat, we will read them, and of course, those of us in the room, if you have questions for that, now is the time.
Savanna? Any questions, anyone? Or comments or anything? Yeah.
I'm not sure if you answer this, but I mean, what's your sense of why Australia acted so differently to the rest of the world? Is there any sort of historical, cultural reason why that happened? Or is it really quite a random event in a sense?
That's a good question.
I suppose I'm asking because you have a sort of sense of how policies differ across, not just about COVID, but policies in general differ across the world. Are there any sort of systemic differences in some ways between Australia and some other nations in this way? Or was it actually quite specific to COVID?
There's a lot I could say about that. So it's making me think of Australia's response to asylum seekers as well. And it's I forget the academic who said it, but that Australia's had an exceptionally harsh response to asylum seekers compared to, I mean, it's happening in other countries as well, but the tightening of, it's so, there's a lot happening. I guess that goes back to the policy that I was talking about over the last 30 years. There's been a real securitization and a tightening of immigration policy over the past 30 years. So I think that does feed into it, because while Australia's not alone in that, it's been COVID is, and I didn't look at America, to be honest, because I was afraid to even look at the response there. But definitely Australia's approach is more kind of on its own than a lot of other countries with respect to COVID. But the I guess the militarization of borders, the securitization of it in general, and sort of that elongating of temporariness, it is gosh, it's just been a. But
that's your sense. Your sense is quite systemic. It wasn't just like a thought bubble.
It falls in line with how things have been progressing. Certainly the last 30 years, but more so maybe the last 10, 15.
Yeah.
So it's Does anyone have any?
I can maybe try to.
Yeah, go for it.
Complicate things. I think with Australia, since the change of government, we've deliberately tried to lower our intake of permanent migrants in Australia. So I think that could signify a particular sort of stance towards immigration, and I think all these ties into the United States as well, with Donald Trump and the rise of nationalism and nativism as well. So I think almost when COVID hit, Australia and the United States were probably quite similar in terms of how from the attitudes towards immigration from the government in power.
Yeah.
Whereas Canada was very different. So Canada right away was, I think, I guess less conservative in a sense, and very recognized right away that migrants were crucial to recovery. So right away they led the charge. And we were just stumbling behind and playing catch up. What they did, we tried to copy. And then if you want to draw comparisons with Singapore, because you mentioned Singapore, again, that's not really not quite comparing apples to apples in terms of how they responded to the needs of temporary migrants during COVID, because they've got very well established temporary labour migration schemes with no access to permanent residency. But a lot of these workers, particularly the construction workers in Singapore, their welfare is responsible, their employers are responsible. And again, temporary migrants, the way we look at it here, they're so broad, right? We've got international students, we've got skilled migrants, we've got refugees, asylum seekers, and I think the access to Medicare does vary from group to group. So international students don't have access to Medicare, right?
Yeah.
But they have their own private health insurance that they need to get. Some skilled migrants on temporary visas have access to Medicare, and that's something that's quite new.
I think just jumping into what you're saying, and this is something I thought I was going to do a presentation on, I might do it next year. I think what you're signaling there is sort of the neoliberal approach that's been very much, there's this desire to have migrants coming in, staying for a period of time, contributing to the economy, and then going. So it's and not recognizing that. And what's coming through now is that there's already some indication that like international students are opting to go elsewhere too. So they're thinking in very short terms, in my view. They're thinking short-term savings, but not like the long-term implications of if we don't, treat people, especially being that, most temporary migrants are net contributing to the economy. There's no sort of,
Cost,
and not being, and I can get into all the, the ethics of that. I'd love to, but it's just, I think it's a short-term sort of, we're looking for, the government might be looking for a quick way to save a buck, but not looking for that long-term implications. And also for social cohesion. So we're just talking about economics there too, but there's also, those aspects as well as social aspects.
All right.
Oh, George is
You
there.
have a question there from, yes, that actually touches upon the ethical and moral obligations. So
I wonder if there have been differentiated treatment or care of temporary migrants despite the policy context. There is a lot to think about. Ethical and moral obligations, higher education has for national students. Yeah, and I agree, and that's the point that I was making before with, we're seeing, it's things in the news at this point, so it's not like we don't have really robust data coming through, but there's things that saying like, for instance, international students from India are, they're going to, I think that the rates are quite down and they're looking elsewhere. And that has, there's something to say for, how you treat people in times of need, I think. That's it. All right. Thank you for your time. I appreciate it.